Good morning, good afternoon, good evening, everyone, and welcome to this TechNet 21 webinar series on deploying an electronic LMIS, making the right choice. I'm delighted to welcome our guests for this session, the topic of which is introducing field supply LMIS software and services. Today, we have with us three panelists from Field Technology Development Partners, Julia Dutch, the product manager, Justin Lorenzen, Chief Technical Officer, and Fatima Alfa Abu, Software Account Manager. And we have our expert from Nigeria who will introduce us to the case study in Nigeria. Isaac Onikutu, Technical Advisor, LMIS Specialist, Nigerian Product Supply Manager Project. We'll start with an introduction of the field supply tool during the first part of the presentation. Then Isaac will present the Nigeria case study. We'll finish this session with questions and answers. So please ask your questions during the presentation in the Q&A box or in the chat box. They will be answered by the panelists after the presentation. This session is recorded and we'll share the links to the video as well as the slides by email and on the TechNet 21 website. I'm sharing with you now, I will share with you in the chat box the link to the page dedicated to this webinar series so that you can already bookmark it and find the registration links to other sessions as well as all the webinar material once it's available. So let me share with you the link. Finally, if you're interested in joining a community of practice of immunization supply chain professionals, you can join our new Telegram group on immunization supply chain, where we'll share information on this webinar series and more. And I'll write the link in the chat box too. And Julia, the floor is yours.
Thank you, Alex. And good afternoon, everyone. I have the great pleasure today to give you a technical overview on our control tower, which has been natively built for EPI and later successfully integrated on the same platform with 5 different programmatic areas. And our LMIS has been designed for public and for private sector as a progressive app, which what it means that it's wide accessible and proved over the last 5+ years to reliably manage the stock situation and to offer advanced analytics in Nigeria across a range of programs such as immunization, family planning, malaria, tuberculosis, maternal and childcare, and so on. We are, so field supply is a standardized LMIS which has been tailored to cater the unique needs of supply chain managers of national programs and key decision makers. And while building and improving field, we made sure there is a mindset behind the methodology, and there is a lot of design thinking going through all the decisions that we make. So for us, it was extremely important that our workflows are supportive, which means that we have flexible user paths, that we are giving feedback at every step, that we have a mobile and a desktop interactions are seamlessly intertwined. And then we are focusing on maximum accessibility for slow connections, for low resolution, for tiny screens, high contracts, and large fonts. So now we will be diving into some of the main capabilities, such as data gathering, forecasting methods, orders and shipments, analytics, and a couple of more. So we are at the moment looking at the deployment of a standardized LMIS system for Nigeria across 5 national health programs, which guarantee data availability, not only for our national managers, but also for our donors and implementing partners in the region, and it's built to promote data utilization with the hope of improving data quality. Regarding a bit the impact that it has, we are talking here about 1 million plus batch level transaction records for over 35,000 facilities across the entire country of Nigeria in the last 5+ years. We will be, we are jumping now into Nigeria's national immunization deployment, which has been built in 2016, where Field provided offline first and mobile friendly capabilities for batch level gathering, which previously were disconnected from in-warehouse activities, and also for tracking shipments, which was unreliably and nearly impossible on poor connections. And of course, that led to broken visibility. And I guess that's not a problem that's happened only, that's not a local Nigerian problem. Forecasting methods. So even if I'm talking about field supply as being a standardized LMIS, when it comes to forecasting methods, then it was crucial for us to tailor them, not just for programs, but even to support state-specific forecasts and allocations, such as the target population, the wastage rate, the coverage rate, and additionally, the functionality offer a way this type of functionality that we build offer a way that to review how all these changes and all this customization are impacting the entire plan. Going forward to the shipment module, here is the place where we are tracking progress and statuses through the entire supply chain, and all the shipment data feeds back into real time, in real time to all related indicators into analytics, as well as bin cuts for each of the products. The next, another immunization feature that the functionality that we worked on, and I want to quickly mention, it's our Vvm sampling. For batches that arrived at any point in time in the supply chain, either on a national warehouse, on a state store, or down to the health facilities. This check, it's a mandatory step. Now we're continuing with the distribution ledger. Sometimes we refer to it as a bin card, and it's our batch level transactional visibility, where we are able to review in real time the stock movements. We can audit specific batches. We have wastage control built in, and we hope that we manage to do that without overly complicated record keeping. And since I'm mentioning wastage control, now we're looking at one of our third-party integration, and that one is with DHIS2. And in this way, we are able to analyze live wastage from external triangulated data. And the calculated wastage is an indicator in field supply that measures the consumption against the doses reported in DHIS2. And this is how we determine the actual wastage of vaccine per location. Furthermore, we're analyzing the distance from target that has been already used in forecasting and planning. Functionalities. To continue and deep dive more into the analytics module, I want to stress here that the fact that we decided to build a disaggregation flow, believing that a natural user experience that allows managing by exception is the key to scale. Each one of these indicators that we're having here has the complete package of processes and thresholds has interpretation guides so that the management team can follow up. Everything, all the data is exportable, and there are integrations with other BI tools for further ad hoc analysis. And now one of the indicators that we're very fond of, and why is that? Because it has a monetary value attached to the impact that we're bringing. And so it directly speaks to the impact, and that's our expire indicator. So we know for a fact that as of today, we're looking at $568,000 of near expiry commodities, which have been identified for expedite delivery, with a further $627,000 identified as a risk to date. And now we're looking at the inventory risk dashboard, and this is the place where it's the place to go as a manager, where all the informations from incoming shipments, from expiries are coming together with one single role, and that is to predict 1 year worth of stock. So we're looking here at the historical data. We're predicting how the stock situation would look like, and the prediction, it's explained through a visualization on the stock movement based on all this data that I mentioned, and it triggers alert and reorder points based on customized administrative processes and rules. Now we're entering in the area of ordering and rationing. The ordering and rationing module has been built with the goal of accelerating the national order preparation and execution. And the value added, we've seen it coming from the fact that a state logistic advisor can place an order for all locations together, which gets further aggregated with other states and displayed for review for the respective zonal managers. So it's practically aggregates all locations together. And so it's a tool for multi-level order preparation, rationing, for rationing, for product substitution, and it's fully integrated with the warehouses. One of the partners here, it was One Network on integration, and it works that the algorithm works on multiple pack size. So it's optimizing for multiple pack size solutions. And other sort of customizations that can be done in here. About our master data. So quickly, I would like to mention here there was a burning need that we had to decentralize the location management and to enable self-administration. As of today, we're seeing more than 34,000 facilities tracked every reporting cycle by 1.2K users. And in preparation for each reporting cycles, there are services, donors, contact data to be edited or changed. And that is now all possible and scalable for our user for users that have the right administrative role. One of the last functionalities, but very, very important for us, that speaks about direct delivery operations. And I want to present today is it was implemented with one of our private sector clients. And the name is Shelf Life, and field supply. In this relationship, it acts as a vendor management inventory for the last mile. And for us, it's it is important, and we're looking at the private sector as a source of financing that helps helps us ensure the financial sustainability of field supply. I think I might be running out of time, but I have to conclude by offering very warm thank you for all the partners and all the supporters that made the system possible. And I think I will give now the microphone to Isaac, who is our technical advisor and an LMIS specialist. And he was going to share in-country experience with you now. Thank you.
All right. Thank you, Julia. Can you all hear me?
Yes, very well. Go ahead.
Okay. So, Julia, please, can I see the presentation? Okay. Yeah. Thank you. Once again, my name is Isaac Onekutu, and I work with National Product Supply Chain Management Program under Food and Drug Services, Federal Ministry of Health, Abuja, Nigeria. Yeah, so the Nigerian Health Logistic Management Information System was born out of the need to have a digital platform that can create end-to-end visibility to stock level across all the public health programs. And the platform is very secure, it's offline capable, and it is user-friendly. This platform has helped stakeholders right from the LGA level, the LGA states, LMCUs, and national programs to analyze critical data trends, and also help to support inventory management decision-making processes, both at national, state, and LGA level. There are a lot of things with the platform. There are a lot of features on the platform, just like Julia showed us some, but the use of this platform will really convince you, and you get to play around some of the features that we have on the platform. So next slide, please. So the challenges of Nigerian supply chain before the NHL MIS came on board, we were using an interim LMIS tool, and the interim LMIS tool was a standalone tool, and to access it was a problem, and we could not really customize it to reproduce some of the templates that we use at national level. It was really, really difficult. And then that was one of the major problems we had. And another one is the fragmented supply chain. Across the national programs, we have 5 major public health programs in Nigeria and others. And for every public health program, they have their own supply chain structure. And it was really difficult to have a visibility into what is happening in the programs coming from as an external stakeholder or even a funder. And then like I mentioned, we also had multiple data systems. And because the national programs don't get to see the data, we don't have a single platform for this data. We have multiple data systems across all the programs, with every program having their own system in place for data management and the rest of it. And then we have a poor data quality. For this, there are a lot of things to consider. One of them is issue that has to do with timely reporting. you realize that we have a set timeline. Every program, they have their own timeline, and it was difficult to stick with that timeline and work with it as far as reporting is concerned. And even that, you realize that the data element for them to report are not consistent. Take, for example, some will report beginning balance, some will not report it. And it was really difficult to make a decision or work with that kind of data. And then lack of aggregate visibility, just like I've mentioned, we don't have a place where we can say, okay, this is a national stock, this is the national reporting rates, this is the national this. That aggregate value across all the programs in Nigeria was really difficult to achieve. And then poor government ownership, because we don't have a national structure in place, it was difficult for government to take hold of the supply chain program of the country. Partners come and then they introduce their own tool, and once they are done, you never get to hear about it again. So government, in terms of ownership, government was not really, was nowhere to be found. And then limited performance management. With everything I've mentioned, you know that, yeah, once you have those challenges in your system, you're really going to have issues with your performance. The programs could not perform up to the level we expected, because most of the decision in supply chain has to do with data. And once you don't have access to this data timely and all other things that you need, it will be difficult for you to perform. And then suboptimal stock management and high system costs. So because we have fragmented systems, every program now has to pay for their own system and then keep it running. And the cost of maintaining each, because we don't have a single platform, was very, very high. And so it was really, really a challenge across the country. And then one other thing that I mentioned earlier, which is known, is the fact that we really had issues reproducing some of the templates that we use at national level in Excel, using some of the tools that were in existence then. And then creating that visibility was one of the major things that we set out to achieve as a country. And we felt the NHL MIS platform will be able to provide us with that, and that has happened so far. So next slide, please. Yes, so the goals of NHL MIS, of course, one of the goals is to improve cost of savings for data collection and lower inventory and transport costs. So before now in Nigeria, we, as you're aware, we have had to reach area, and the cost of getting these people to transport or even move data from one location to another was really a problem. And then, but now with this platform, it becomes very easy for them to sit in their location, and then coupled with the fact that it has offline module, it's very easy for them to impute this data and then even wait until peradventure there is no network. They can also wait a little until the network gets better so it can sync properly. So we also have reduced amount of redundancy and overlap in the warehousing and distribution systems. Currently, we have all our warehouses on NHL MIS, at least the zonal warehouses and the central medical stores warehouses are on the platform. So it's very easy to track what we have in there. as well. So significantly reduce the occurrence of stockout situation at facilities. So before the NHL MIS came on board, you can have a facility that is very close to, let's say facility A is very close to facility B, and then the facility B is overstock of a commodity. We have national timelines. Let's say they have 5 months of stock or even 7 months of stock in some cases, and then facility A is stock out completely. But it was difficult to know. But with this platform, we've been able to have that visibility into what is left. So with that, it's very easy to redistribute some of these commodities from facility B to facility A, and then try to create stock balance even before the resupply period. And then minimize wastage within the system. We've also been able to track our expiries with this platform. And with that, we had in mind to be able to reduce wastages across all the public health programs. And then significantly lower time to respond to low stock or stockout situation, on timely avoiding stockout. I already explained that. And then entrench ownership and accountability into the supply chain, particularly at government and state LMCU level. So this platform has been able to help us to create coordinating bodies across the states. That's the state LMCU. And then we also have the LGA LMCU. And then with this platform, they now have a tool that they can work with. So their decision and every step they make is based on the analysis or the analytics from NHL MIS platform. And this has been one of our goals and one of the things that we wanted to achieve as a country. Please, next slide. Okay, so key modifications made to the Nigerian supply chain: one central data repository to help improve access to databases at all levels of the supply chain. So currently on NHL MIS platform, we have 5 national public health programs with over 35,000 and still counting facilities on the platform. And we are also working to bring other programs on board, like the essential medicines and NTD, nutrition, and the rest of them. And all this as a result of the gains from using this platform. Also, we now have a single, a central data repository for NHL MIS, and then timely visibility into warehouse data, the dashboard visibility across all levels, across all levels to support state and national programs with key data to improve decision making. So for Nigeria as a country, all our indicators are there on the platform, and this helps us to improve decision making and unified data, ordering and distribution flow across programs. So NHL MIS guide us in terms of ordering what is required to resupply the facilities based on their consumption. So that has taken the burden of us sitting to calculate what to resupply facilities one after the other. Next slide, please. So the features of NHL MIS: APIs for integration with warehouse, EPOD and DHIS2 created. So we currently have a linkage between NHL MIS and DHIS2. DHIS2 is for service data, while NHL MIS is for logistic data. So we try to create that linkage to enable us to triangulate the service data with logistic data. So that interoperability is there. Then orders and rationing, the LMD feature has simplified the ordering process, which reduces time to place orders by 4 weeks. So it also enhances our resupply processes and then allow us to resupply them at the right time. So we have QC alert, which also help to flag reports with issues and also give us an aggregate of all the reports with issues as far as the platform is concerned. So the QC alert is also on NHL MIS, which help with data validation. So before now, what we do is review meetings, you look at the paper form, and then you try to validate them, but automatically the platform, through the QC alerts that we have on the platform, it helps to validate some of this data. Next slide. So we have analytics, like I mentioned, indicators are there. These are some of the indicators that we have on NHL MIS: stock reporting rate, flag report, stock out rates, month of stock, the month of stock cover, MOS plus orders, like when you resupply the facilities, what will be the amount of stock, and then the expiry indicator and the average monthly consumption. If there is a drop or an increase, we also try to have that visibility. And then we have the master data management, which help us to manage the platform in terms of product, facilities, users, and the rest of them. Next slide, please. Okay, so like I mentioned, there is a lot of improvements on the platform. We have 5 public health programs now onboarded and reporting on NHL MIS nationwide. And I am very sure before the end of the year, we could have more than 5, if not 7 or 8 thereabout, because we have plans to onboard more programs. And then we have over 30,000 facilities reporting on NHL MIS, and we have users. So the users ranges from national to state level, and then to facilities and the rest of them. So all this put together gives us a very, very unique experience with NHL MIS. So these are the programs currently on NHL MIS: family planning, malaria, HIV, maternal and newborn child health, and then the TB, which is the most recent of the programs that we just onboarded. Due to the complexity with the TB, though it was difficult, but then the platform, we were able to customize it and then reproduce some of the structures that they have at NTBLCP, which is the National Program for Tuberculosis. So all these are the gains and even the challenges that we've experienced as a country. And we are also developing more features based on the needs of the users. So every day, every year, we try to also improve on what we have to cope with modern supply chain challenges. So as things keep on evolving, we also try to bring on board features that can help us cope with these challenges. So at least now we can easily tell where our facilities are. That's also helped to eliminate issue of proxy delivery in terms of most times when we were doing basically the paper form, it was difficult to get an accurate location of a facility. But now you know where they are located and delivery is really made easy. So that proxy delivery is reduced to the minimum with this platform. So I would like to stop here. Thank you. And if you have questions, I will be around to answer as much as I can. Thank you, everyone.
This is great. Thank you very much, Isaac. Thank you, Julia and Isaac, for this great presentation. Well, you have received some questions, but if anyone has more questions, please don't hesitate to ask in the chat box or in the Q&A box. Let's start with the first question. Well, the first question is about accessing the presentation and the recording. So no worry, we will send you the slides as well as the recording of this video by email to everyone who registered. So that people who struggle with their connection can also rewatch it, or you can also share it with whoever might benefit from it. Someone is asking for the web link for field supply. I think it was shared. Let me share it again. It's HTTPS. Well, it's actually field.inc. So FIELD.inc. I'm just writing it in the chat area again for everyone to have access to it. There was a question in the oh yeah, there are some new questions. Excellent. There was a question that was answered by Justin, but it was answered. He wrote, so I'm going to just say it verbally so that people who watch the video later know about it. So there was a question about, is LG level, a district level, above health facility point of care? So LGA is a district level, local government area, above health facility, but below states. That's correct, Isaac?
Yes, that's very correct.
Cool. The next question, is field supply used at the end user level? Between brackets,
at LGA level.
Yes, between bracket healthcare facility.
Yeah, so the secondary health facilities enter data directly from their own facility, and then the primary health facilities, they submit data to LGA officers who help them to impute on the platform. So data is entered on from the facility, and then also at LGA level, and even at state level too.
Okay, thank you. Another question, is field supply as health facility to health facility transfer option?
Okay, when you say transfer options, do you mean in terms of commodities?
Let me see who asked this question so that we can ask, let me check, is field supply. Sohail Iqbal, if you can perhaps give more information about and answer Isaac's question, and then he can answer your question more precisely. So the question was, is field supply as health facility to health facility transfer option?
Yes, so in terms of transfer, right, for TB programs, for example, it's help with patient transfer in terms of letting them know where facilities with commodities and where they can go to get tested and all that, because it's not all facilities that can conduct tests to detect the TB and then the HIV stuff. So it has also helped to provide such information. And in terms of commodities, so I mentioned earlier with the redistribution, where you have some facilities overstock and then some are stock out. So we can transfer commodities from such facilities and ensure that they will not be stock out before the resupply process. So it has really helped in terms of transfer both patient and then commodities as well.
Perhaps I can just add to that. Everything that Isaac mentioned is, I think, is a good answer to that question. I would just also add that on the private sector use cases and immunization, we had allowed facilities to transfer stock in between facilities. That's not a use case that is currently in play in many of the programs in Nigeria, because it's managed at an LGA or at a state or national level, the redistribution. But the platform does support it if the deployment is configured for that. And I also say just a follow-up question about the reporting. And again, maybe I can just tag along Isaac's answer there, that yes, some facilities do report directly on the application. And for those were the secondary facilities that Isaac was talking about, and for those that do not want to or can't, then they can continue to send paper reports in for digitization at the LGA or state level. So it's a hybrid model which supports both modes of reporting.
Okay, thank you. I think there was a similar question because George was rectifying something. Let me find your question, George. That was, is field supply used at the end user / facility level, between bracket hospital, clinic, community health worker, vaccination sites?
So I think we already answered.
I think, yeah. Okay. Right. Next question. There are over twice as many facilities as users. So between brackets 30K versus 12K. Are users reporting for multiple facilities?
Yes, also, in a facility, you could have more than 2 or 3 users. And in some cases, you can have a facility, like I mentioned, we have the secondary facilities, they report directly, and the primary health facilities, some of them, those that are developed enough can also report, but it's not all facilities that currently report on directly from their facility. So we also have like users that report on their behalf. So, and that's why we don't have equal number of facility and users, because this thing, and in Nigeria, we have more primary health PACs than the secondary and tertiary facilities. So some of them, the data entry is done on their behalf by the LGA and state LMCU.
Thank you. The next question, is field supply the new logistic management system for the Nigerian vaccine program? At what level is it currently being implemented? How is it different from the Nigerian immunization supply chain management information system?
Maybe I can start that one, and Isaac, you can follow on if I miss anything. So field supply originally was the platform which ran the immunization or Nigerian immunization supply chain control tower. However, 2 years ago, that switched over, and so with a change of administration, so for administrative reasons. So currently, the current Nigerian immunization supply chain management information system is not running on field supply, although we hope that it will again in the future.
Thanks. Isaac, would you like to add something?
Yes. So I must say that before we onboarded the other programs, immunization program was the first to use the field supply. And at that time, we were struggling with the right tool to capture data for the other national programs. So with what we saw in immunization program, that made us to adopt the nhl MIS as the platform for public health programs going forward. And we are also working at national level to have all the national programs on one platform, including immunization, or have them linked to nhl MIS, whichever way we can. So with that, I can assure you that, yes, we will have everything national public health program on nhl MIS platform. Thank you.
Thank you. Next question, and that one is probably for the team. Someone would like to know to have an indication of the cost of this for the software. And I think there was another question about the approximate costs to start and sustain your tool in a country.
Yeah, so the platform is provided as a service. So we provide in the nhl MIS platform as a service under a service level agreement with the government of Nigeria. We did that for a few reasons, mostly for this fast spin up time. You know, those of you who are familiar with software as a service know that you can set it up, configure it, and it will be always on. So all of that hosting and support is taken care of. And this just seemed to be the fastest and most sustainable way to run it. So that is currently how it's being run. The pricing works on a basis of scale, but as you have seen from the presentation, the platform really has been built to run at a very large scale. This is one of the problems that we wanted to solve with it, given that most of the solutions we were looking at back in 2016 when this started would have scaled prohibitively with prohibitive costs, those that are based on, you know, price per facility. So I think that it's a little bit more complicated than just sort of dropping a number in chat, but suffice to say that it would be quoted as a service. So on a, you know, a sort of a running basis based on how big the deployment would be.
Thank you, Justin. The next question. Is Field Supply the new logistic management system for the Nigerian vaccine program? At what level is it currently being implemented? How is it different from the Nigeria? I think we mentioned.
We've answered that question.
Yeah, sorry, I copied it twice. Yeah, the next one is, does this ERP work? ERP, I don't know if it's really an ERP, but does this tool work with internet connection?
Yes, it's cloud-based. So though it has offline module that allows you to enter data, and then you now maybe when the network gets better or is available, you can now connect, and then the data you entered will sync with into the database. So that's how it works. So it allows you to enter data offline, but because it is cloud-based, you require an internet connection for that data to sync.
And a similar question, can the software function offline?
Yeah, yeah.
Voila. The next question, is the nhl MIS built on the field supply system? Is it a government for partner funded? And what is the sustainability plan? Is there a plan to integrate the nhl MIS with vaccines LMIS in the near future?
Yes, as a matter of fact, in one of our meetings just yesterday, the minister made it clear that all other tools should be linked to nhl MIS program, and then we should also look out for ways to ensure we have one data repository for Nigeria as a country. So currently with that, every tool, including the one that Immunization is working on currently, will be linked to nhl mis, and it will appear on nhl mis. Yes, so, and then in terms of sustainability, currently the nhl mis platform is government partners funded. They support the country to fund this platform, but we already have a sustainability plan in place through, like I mentioned, we're bringing on board the essential medicine. So we want to integrate essential medicine and public health program. So we have a project, the RSSH project by Global Fund currently, with MPSMP as the SR and NACA as the PR, will be able to establish DMA, that's the DRF, the Drug Revolving Fund, and then see how states can make use of this platform to manage their supply chain, and then in turn, they'll start contributing a certain percentage to the payment of the subscription for the nhl mis. So we are currently working on a roadmap. That roadmap will provide us with when states will start making their own contribution, and then partners will completely pull out of the payments of the nhl mis subscription. So that plan is already ongoing. So we have between now and 2025 to effect that. But the very first thing to do is to ensure that the structures that we have in at national and LGA level can run independent of allocation from governments.
Thank you. Next question. Well, actually, I'm going to merge two questions. The first question is, does Field Supply integrate cold supply chain? And is there a web application? And there's also a question if there is a mobile app for the facilities who are reporting directly.
Yes, so, okay. Go ahead, Justin.
I was going to say on the topic, that is not something that is currently supported in the platform, although we've had discussions around it. We do not currently have a program which has prioritized that. So it's on the roadmap, and it will be implemented when we get a program that makes that a priority. As for the mobile app, yes, it is available as a mobile app for facilities.
Okay, but no web application.
Yeah, it's both. So it's deployed as what's known as a progressive web application, which means that it on a browser, on a desktop, on a laptop, and also on a mobile device offline if need be. Excellent.
And because you were talking about other programs, are there other countries that are using your system?
So in the private sector, yes. So the shelf life program, which deploys Field Supply as a vendor managed inventory platform. So it uses the same platform, but manages private sector pharmacies, distribution of pharmaceuticals to private sector pharmacies. That's underway, or that's in use in Kenya as well. But there are no other national government deployments other than Nigeria.
Okay, thank you, Justin. There's a question about accessing training in Spanish for Latin America. Do you have something like that?
No, not currently. Although I think Julia speaks a bit of Spanish. So hey, maybe we.
Maybe when you get a contract with a country in Latin America.
I'm already smiling.
All right. The next question: can you provide information on implementation of eLMIS in a complex context? For example, lack of infrastructure. That's something that was partially answered, I think. But is there anything you would like to add on that?
I think in terms of the technical infrastructure, the kind of the minimum that is required is a cell phone connection. Because it's cloud hosted, then anybody with a cell phone or a smartphone that can access the internet can access the platform. It doesn't require installation. I would say that probably some of the states in Nigeria where we're using it are fairly complex settings. I don't know, Isaac, if you have anything to mention about adoption in some of our more offline states.
I'm fine. So yeah, you said it all. So thank you.
Okay. A question about the next question is someone would like to have information on deployment steps of eLMIS from a paper-based LMIS system. Any take on that?
Okay, the deployment. So what we did, we have, like I mentioned earlier, we have our own paper-based forms, and these forms behave in a certain manner, just like in form of Excel printed on papers, and then at the health facilities, they fill these forms. But some of these forms are reproduced on nhl mis. So by the time they see it on the platform, on nhl mis platform, it's something they are used to. It's something is the same as the paper form. Like the data elements are the same, and it takes away the burden of them having to calculate something like consumption and the rest of it, because on paper of course cannot perform any form of calculation for you unless you do it yourself. But with nhl mis, once you put the required data element to help to solve other problems for you.
Thank you, Isaac. I think there's a last question. It would be appreciated to have a rough number on some facilities which use field supply at the end user level. Like a percentage.
Okay, like a percentage. So currently in Nigeria, we have across all the programs, of course, you know, there are some facilities, they only offer malaria service, some only family planning and all that. So across Nigeria, currently, we have 30,000 reporting on nhl mis, like different facilities, now at least one or more programs. So, and the total number of facilities that we have currently is around 38,000 plus. So if you look at it, I can say we have more than 80% of facilities in country on nhl mis.
80%, that's great. Okay, is there, I think we answered all the questions. Is there any last question? If you want to ask a last question, that's your last chance for today. No, I don't see anything. So I think we've answered all the questions. Thanks again, Julia, Isaac, Justin, and Fatima for your time and for this great presentation. As a reminder, we'll send you the links to the recording and the slides by email to all participants. So they will be also made available on the TechNet 21 website. I'll share the link again in the email. You can already register to our next session next week. And I'm putting, well, I actually don't have the link right now. So yeah, I have the wrong link. No problem. I will send you the information for the next session next week. And thank you again. We hope to see you next week. And thanks again to all the panelists. Have a good rest of the day and stay safe. Bye-bye.
Yeah, bye. Thank you.
Bye, Isaac. Bye, Justin, Fatima, Julia.
Thanks, everybody.
Thank you. Bye.
Bye.
Thank you.